Lung cancer happens when cells in the lung change or mutate. Most often, this is because of exposure to dangerous chemicals that we breathe. But lung cancer can also happen in people with no known exposure to toxic substances. According to the American Cancer Society, lung cancer is the leading cause of cancer deaths in the U.S., accounting for about 1 in 5 of all cancer deaths. Each year, more people die of lung cancer than of colon, breast, and prostate cancers combined. However, there is optimism with new treatments available. That means a diagnosis is not always a death sentence. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Here to discuss lung cancer screening and new treatment options that are changing patient outcomes is Dr. Mark Sosinski. He's a thoracic medical oncologist specializing in thoracic malignancies, and he's the executive director of the Advent Health Cancer Institute. Dr. Sosinski, thanks for being with us.
My pleasure, Netta.
That's a mouthful. A thoracic medical oncologist. What does that mean?
Cancers have become so subspecialized and complicated. So 30 years ago, I decided to focus on one cancer, one anatomic site, and that happens to be the lungs. And so that's what I've done for 30 years. I was in academic medicine most of that time, but then came to Advent Health, where what we're trying to recognize is the complexity of cancer really demands a subspecialty multidisciplinary approach to each patient, because the therapeutic options have become so heterogeneous and varied that you want to make sure that each patient gets personalized treatment, right patient, right time.
So when we say lung cancer, we're not talking about one thing.
No, whereas 30 years ago, we kind of approached lung cancer as a one-size-fits-all. It was the kind of the realm of chemotherapy, if you will. Mm-hmm. What we've learned over the past 20 years is that this is 30 to 40 different diseases. It's diseases in which the DNA of the cancer has undergone certain alterations that create what we call targets. That's allowed us to develop targeted therapies, which are much more highly effective than chemotherapy. We've also understood how cancers can evade the patient's immune system. So we can manipulate the immune system with immunotherapy by itself in selected patients based on our understanding of the complexity of the cancer and what this individual cancer is doing.
Now, there are a couple of ways to look at that. When you say the cancers have learned to evade the immune system, that can be frustrating, I would imagine, or exciting if you're in the world of research. Where are you on that spectrum?
This is exactly, there was a gentleman that won the Nobel Prize 30 years ago because he discovered how cancers hide from the immune system. And once you understand how cancers hide from the immune system, you can develop new therapies that kind of break down that shield that the cancer is putting around itself. We often see in biopsies of cancers that there are T cells, part of our immune system that are fighting things. There are T cells at the level of the cancer. Why aren't they destroying the cancer? And it's because the cancer is kind of putting them to sleep. Well, we now have new therapies that can wake up the immune system and attack the cancer, and they're highly effective in many patients.
So do preventative measures help when you have a disease that's kind of gotten smarter than it was?
Well, obviously everyone knows that there's a relationship between smoking and developing lung cancer. So my message is don't smoke. If you are smoking, stop smoking. If you haven't started, don't start. And if you are smoking, please stop. It's not easy to stop. Nicotine can be very
It's addictive,
Yeah. So from a preventative point of view, yes, there are some risk factors that we can alter. The other thing that's important to understand is that in the United States, there are about 30,000 people who have never touched a cigarette who will develop lung cancer.
Okay, that's a frightening number.
So, and these are people that have all of these, or are enriched for these DNA alterations that I referred to earlier on. They're either specific mutations or what we call fusions that really become the light switch of the cancer.
Say a little more about fusions.
It's when a part of your DNA breaks away in couples with another part of your DNA. So that fusion efforts, and what that typically does is turn, for simplicity's sake, turn the light switch on of the cancer. It's a growth stimulus.
So is that a hopeless situation?
No, it's actually a good situation because our laboratory scientists have developed ways with targeted therapies to switch that light switch to the off position. And these are highly effective. It is such a different therapeutic environment now for patients that have these DNA alterations.
What excites you most? You've dedicated over 3 decades of your life, and you've seen so many changes. What is the thing that really gets you excited about research, where we're going, what we're discovering?
The thing I love about oncology is that we do not settle for the current standard of care. Our goal is to understand cancer better through basic science research, and to then develop potential treatments based on the understanding of the science. And then we have to test those treatments with clinical trials. At Advent Health, we have recently opened a clinical research unit at our Celebration site. And what we're doing is bringing novel therapies. These are often first-in-human therapies that have great promise, based on a deep understanding of the biology of the cancer and what the target is and what happens when you inhibit the target. So what I'm excited about is getting to away from the concept of one size fits all to say, in every single patient, can we understand that cancer as best as we can, and can we create a personalized treatment approach for that individual patient based on that understanding?
So the future, if what I'm hearing you say, is it can actually be designed for you.
To a certain extent, by understanding the cancer. Now, we've come a long way over the past 10 to 15 years, but we still have a ways to go. And what excites me is that the discoveries keep coming, the new therapies keep coming, the understanding of it keeps coming, and so that helps us be optimistic. You know, when I was trained in lung cancer, I was trained when patients have stage 4 or metastatic lung cancer, cancer that's spread outside the lung, I was trained to counsel patients to say that you have a treatable disease, but you don't have a curable disease.
Would you still say that today?
No, I'm saying today that I can, in my practice here in Orlando, I have patients that have had stage 4 metastatic lung cancer that I believe are cured by these new therapies. It's not anything I ever thought that I would say 20 years ago, but it's the reality of treatment now. So this pessimism in what we used to call nihilism about lung cancer, we need to push that by the wayside, because most of the public thinks that lung cancer is a death sentence.
Yes.
It's not, I'm not saying it's an easy disease, but what I'm saying is that the treatment options for patients in getting the right treatment to the right patient at the right time have exploded. And so my ability to kind of bring these therapies to the patient with a heightened level of optimism and hope, and we are clearly making people live longer. We are making people live better, because if you can control the cancer, you don't have symptoms of the cancer. And Annetta, I think we are curing selected patients.
That is the best news I have heard in a very long time. And I love that you use the words optimism and hope about something that most people start wringing their hands.
Exactly.
Thank you, Dr. Ciesinski.
My pleasure, Annetta. Thank you.
We will be right back. Don't go away. Although lung cancer is the leading cause of cancer deaths, more than all others combined, the news isn't all bad. As we learned today, there are new treatment modalities, and some can even be custom designed. That's one of the reasons we do this show, so you can get educated and have longer, healthier connections. I'm Annetta Wilson. Thanks for joining us.